Hi, welcome to Tuesday Talk. This is going to be an extension on a previous talk we had, which was the breast implant associated anaplastic large cell lymphoma. We sometimes refer to that as BIA ALCL. I'm just going to say ALCL because the other stuff is just too hard to keep spitting out. When we talked about it, we talked about why it occurs, or not so much why, where do we see it? And we see it in textured implants, and specifically macroporous or macrotextured implants. Well, recently, Allergan, who was a producer of macroporous implants, just recalled all their textured implants for that reason. So what does that mean to our patients or people who have implants? Well, first of all, worldwide, something like 18% of the implants used are textured, okay? In my practice, I rarely use a textured implant for a cosmetic procedure. If I use a textured implant, it's usually in somebody who has a breast reconstruction. And even within then, most of mine are from Mentor, and they are not macroporous or macrotextured. So their risk has not been shown to be any different than smooth implants. That's what the preliminary data shows. Now, for patients who aren't sure or think they have macrotextured implants, should they get them out? No, there's been no recommendation that that should be the case because the incidence of ALCL is still exceedingly low. Having said that, what should you do if you have implants? Anybody who has implants, if you develop swelling years after your surgery, one breast gets larger, you need to have that evaluated. You need to have an ultrasound, and if you have fluid, that fluid needs to be sampled and tested. The majority of patients who have fluid collections are not cancer. Okay? So if you have any questions about what type of implants you have, you can call your plastic surgeon. They probably still have that information. You still have it on the card if you retain that card from your surgery. Thank you.